okay with you. Okay, so that you'll feel comfortable because since you can state actually the facts, like how many days before na wala pa sa shampoo. Okay, and very importantly, you have to check on the head as well. If there are some wounds sa head, possibly nga dili ka pwede mag-shampoo sa imong patient. Pwede ra hair care ko, possibly wala shampoo. So you need to have a doctor's order for that. They get it. So what else do we need to do? Mag-ready ani. Check this ako. Unsa pa? Before that, preparation, other than equipment mo, dapat na.
Itong sa kuha mo day.
Dapat na.
Ito sa bed making
Apron with you, okay, if walay, kana, ano na siya, that's the attitude part already. Nga ka ng confident kasi imong ginagawa, okay, that's why, more on sulti-sulti, we would say, as we suggest, so that at least, okay, less na ang pangutana sa imuha nga, ano ni, ano yun, sorry ka, yung ma'am ha, kanang, ano kayo ni, my back is very sweaty good. Okay, rubber man good sa ilahat ano. So again, if you have gloves with you, you can use the gloves. If wala may any issues, say for example, ang common is that when you wear gloves, is that most likely, it will be your blood and bodily fluids precaution. Because especially mag-batting ka na. Pero first lang, one lang kami sa taas tayo. Sa taas. Okay, but another thing is that, if na ay skin
Cute kay bata.
allergy, or any suspected na communicable problem ang imong patient, you have to use, of course, something na makaprotect sa imong hands. Alright? So, if wala mo yung
Tulog
ani
jud
for
siya.
the bed bathing, I would allow ra, okay, for you at least to bring an apron. Okay? But if you want to have this one, okay ra po. This one is not reusable. This is disposable actually. Pero if you want to,
Kuya wala si dito.
ana ra, PPE ra di. Because you will be taking care later on sa inyong patient. You have to make sure na protected po ng inyong self. This one, make sure nga you have this. Kaya you're messing man with water. So you have to make sure also protected inyong body. Gets? This one, dapat protecting is yung hands. Again, blood. Pwede, kung may wound ang imong patient sa head. Bodily fluids, kung mag-bed bath, comes especially that part there. They get it. So you are actually protecting yourself. At the same time, any other communicable diseases nga pwede ma-spread from one person to another. That's why you are having your PPEs or protective equipment. If ang patient is respiratory nga problem, you have to wear your mask. They get it. If you are having a respiratory problem also, like your common flu, you have to protect your patient by wearing your mask. Okay, that's what you call your reverse isolation. I-isolate nimong self imo, harong ang imuhang masakit, dili makuha sa inyong patient. Do you get it? So, daghan mo pinaprocess sa inyong mind, so you really have to ask already kung saan yung mga problema ninyo. Alright? Sige, one thing that you have to tell your patient, very importantly, okay, again, adjust the temperature, ang AC, you can adjust that. And if you are in an area nga ward siya, kay daghan mga patient, you have to provide that drape. Can you see that? Kanang ligatang sa kilid. So, you have to provide a drape. Okay, or pwede ka mo kaingunan sa inyong assessor that I have to close the curtain. Okay, so that privacy is provided to by patient. Pwede rin na siya. Okay? And then, what you do, sir, okay na ba sa inyong mag-move ka dito dapita sa ako? That is diagonal ka paing anak. So, this part ra, ang ipamove sa inyong patient. Sibong din, sir? Paduol. Kaya dili ka pwede mag-batting din na or mag-shampoo kaing anak ka. Hindi paduol. Alright? So, another thing that you have to consider, there's a possibility na kaning end, kaning lower end, darang na ako mga direktor sa ako ang dapita. But anyway, sige, ani, pwede ninyo i-remove ang pillow. But very importantly, what you need to ask your patient is, sir, okay na ba sa imo i-remove ang imo ang pillow? If your patient has a problem on oxygenation, kita mo na gina-clip, pulse oximeter, any COPD patient, your cardiac, your chronic obstructive pulmonary disease, for example, kanang mga smokers ninyo, kanang na-pneumonia ng mga patients, most likely, or congestive heart failure ng patient, they cannot tolerate without a pillow. So very important po na i-ask. If patient can tolerate a pillow, sir, okay na ba sa imo nga wala kay unlan?
Hala si Sir
Okay,
Galo.
can I remove this pillow? Okay na. Pag nagyasa, anyway, remove it slowly. Remove it slowly. But if your patient cannot tolerate, make sure na naarap Kay naara ang pillow sa iyahang bed. Do you get it? Okay? Sige, ano sir? Ibutan na to ni sir. If you have an extra rubber sheet, better. Okay, why? Mabasa man na siya ang ilalong. Correct?
Yes.
Okay. Sige, I'll just fold this one. Sige. Taas na sir. Okay? And then another will be this one. Kung we're trying to inflate this one is called your Kelly's pad. Okay, this one, Kelly's pad or Kelly pad. This one is actually, ang common na gina-use aning area will be the perineum. Okay? You know what the perineum is?
Yes,
Naka-anatomy mo, asa man na siya. Okay, kaning dinhing tapita. Okay, so meaning to say, when you wash the pupo of the patient, when you wash the perineum, the vagina, maybe the penis of your patient, this one is commonly used wherein your patient's legs are spread. They get it? Means say mo siya ginabutang sa lubot sang imo ang patient. They get it? Now, but another purpose of this one will be to capture, dili siya actually para sa ulo because there's another type of equipment that we use for the head. But for, of course, demo purpose, we only have what we call your Kelly's pad. Kelly's pad or Kelly pad that they would say. Now, this one here, inflated di siya dapat sa head, sir. Alright. Mutaas ni siya so that i-capture yung water and then hindi siya dito sa pail. Okay, ana siya dapat. Okay, nga na siya dapat. Mauna siya gina-inflate, ha? Say it again, spoon.
Or sa perineum.
Ito man ka.
No, this one is if you're doing a procedure, say for example, na ay babae nga panganak, na ay gioperahan, na dito sa perineal area, we use this one.
Saan siya po, please?
Nagalithotomy, are you familiar with galithotomy? Diyos ko floating in your mind. Kanang nagabilangkad ang patient. Kaing ana ang iyang tiil. So, you tell the patient, if the patient is able to, ma'am, itaas mo ang lubot. Or isa ka ang lubot. Ana mo na siya. Oo. Okay, ana. Murag ka salbabida po din na sa lubot kapit. Okay, but take note ha, mauna ninyo karong update. We don't commonly use this in the area. Kay they are oftentimes reusing this one. So the more ang chances nga kanang hugaw nga naa dinhi kanang mga dugo, mga pupo, mga ihi. Okay, even if you disinfect na siya afterwards, there's a possibility nga ano ra ang bacteria from one person to another. That's why sa actual right now, we only use what you call your katong garbage bag. Okay, maura na siya. We put that over it. But just of course for the demo purpose, we have this one. So yung sabihin na dapat. Kasi patient, you can ask the patient actually to inflate this. Okay? So yung ana siya for ano na niya purpose sa yung ani ha. Okay, so maybe I can ask lang someone to do like this here. Oo, harong makaano siya. Tapos din hita sa dito. Okay, so if your patient's hair is quite long, so dapat Dito na ma'am, ingon ako. So for the preparation, what you do, you need two towels. So one towel, you have to actually fold it. You have to fold it longitudinally. Okay, kapaing ana, so that at least you put it here. Okay, taas. Paing ana sa imo ang patient. Ang ana siya ha. If you want to make it longer, okay, rather than naka-crosswise siya, ipataas mo. That's one. Another is that one should be over here. Okay. Importantly, kaning top sheet ninyo, you move it a little downwards. Makanaog mo ni. So that you can still save your top sheet. Do you get it? Most especially if you don't want actually to discard the linens. Okay, so what you do kaning towel, you put it over sa iya, across sa iya ang chest. So pwede i-open, pwede po dilip. Okay, pwede i-ana. Pwede po dili ra. Okay, so depende rin na sa area ninyo. So ayaw po silito yung anak silito.
Ayaw ano.
Excited ka ayaw.
Excited ka?
Sige, another thing that you need to do is at least na amoy face towel. Ang purpose ng face towel is, tabunan sa nawang, ang purpose of this one actually is just to cover the eye. Okay, ang eye parts ang imong patient.
Murasag mo pa ilong. Magpas-breast augmentation na siya.